All right, so for my assessment, I have to do the abdomen, and I will first start off by asking, have you had any abnormal problems going to the bathroom at all?
No,
When was your last bowel movement?
about 2 hours ago.
And did you have any problems urinating at all?
No,
Like any burning? No?
no.
All right. So now we will start to inspect the abdomen, and we are looking for any masses, any pulsations, the contour, and the symmetry. And we have a flat contour, and there seems to be no wounds or anything, no problems. So now we will start to auscultate, starting in the right lower quadrant. And a normal thing would be to hear 5 to 34 bowel sounds per minute, and you would listen for 5 minutes. But for my time and your time, we will listen for about 15 seconds each. And then we would go clockwise, going up to the right upper quadrant. And then to the left upper quadrant. And then down to the left lower quadrant. And then noting if they were hypoactive, hyperactive, normal, absent. And now we will listen for vascular sounds. And an abnormal finding would be a bruit, and we would use the bell of the stethoscope. We would start off right here. And then going to the arteries. And there was no bruit being heard, which is a normal finding. We would then start to percuss the stomach, going all around. Noting for dullness, and you should hear tympany all over, and then dullness over organs like the liver and the spleen. And then finally you would palpate, doing the right upper quadrant last, because for this scenario, patient is experiencing pain in the right upper quadrant. So we would start with light palpation, going about half an inch down, feeling for any masses, tenderness. And then finally we would do deep palpation, yet again feeling for any masses or anything. And then we will also palpate the liver, since that is in the right upper quadrant, hooking right underneath the ribs. And then, since it is also in the right upper quadrant, we will test for Murphy's sign. And you do that by going right about here, and then asking the patient to take a deep breath in. And if they are experiencing pain and they stop inhaling, it would be a positive sign for Murphy's.